Postpartum hemorrhage risk screen can be documented from the Women's Health View in OB intake. Be sure to chart off all aspects of the screen so that it generates a PPH risk factor score. This is important because the high-risk score charted will create a system-generated order to have 2 units of PRBCs prepped. The fall screen can be found in iView under the Systems Assessment band. It is best to be completed during the initial patient intake. The screen should also be updated when there is a change in care. For example, start of narcotic meds, insertion of catheters, or during different stages of birth. The suicide risk screen. The initial CSSRS should be completed through the OB intake summary when the patient first arrives to the hospital. While completing the CSSRS, the risk level will auto-populate based off the answers chosen. When choosing from the options within the suicide risk interventions, pay close attention to the include at a minimum asterisk. For example, if a patient is high risk, there are 11 risk interventions that must be checked. Now let's talk about the CSSRS suicide risk patients. If a patient is at high or moderate risk for suicide, a patient safety attendant or PSA needs to document 15-minute checks. If the patient is at high risk, this will need to be done at the bedside. If the patient is at moderate risk, the PSA can be in line of sight. Both high and moderate risk will need a paper care plan done. A patient safety plan needs to be completed upon discharge. A lifetime assessment needs to be completed by the social worker. The turquoise wristband is for high-risk patients, and the band stays on until a lifetime assessment is completed and the patient screens either as a low or no risk. The provider will need to document on the 6 risk factors for suicide when deciding to discontinue the PSA. PSA documentation needs to start from the time the patient is deemed a high risk until we get an order from the provider to discontinue the PSA. Document under Communication Physician the time the physician gives the OK to remove or discontinue the PSA. The care plan is a paper form. Make sure all the fields on the care plan are completed, including the initials. Also make sure your signature has a date and time. On the flow sheet, make sure all the documentation at the top is completed on each page of the form. It needs to be done every 6 hours. Document on the flow sheet when the PSA is discontinued. Finally, remember to complete the patient safety plan upon discharge. The sitter monitoring form, on the other hand, is for non-suicide risk patients. Remember to fill out all the fields on each page of the sitter monitoring form and make sure that the start time matches the time on the flow sheet. Now let's talk about provider communication documentation. Communication physician is used for any critical result notification. Along with critical labs, there are several OB-specific topics listed as options to choose from within the Notified Of dropdown. When documenting a physician communication, be sure to chart within the correct time column in which you reached out to the physician. For any critical values, you must check both options for critical value reported and read back to be compliant with documentation requirements. Reviewing orders. It is important to continually look for and review your patient orders. This can be done by reviewing from the Order Plans page within the patient's chart or by clicking on the white checkbox icon within the RN RVW column on the Women's Health Tracking Shell. Once reviewed, the white checkbox will no longer be present. If you get into the habit of regularly reviewing your orders, you will be able to easily see if any other new orders have been placed. The next topic is Home Medication List. Open your Home Med List by clicking on the Meds History button under the Adult Intake. You will use the Meds History button or External RX History button to review and add or remove any medications from the Home Med List. The External RX History button gives you the option to import the last filled medication list and individually add them to that list to the Home Medication List to document on the patient's history. Keep in mind that the external RX history list may not necessarily have all the medications that the patient is currently taking. Manually adding the medications to the home med list can be done by using the Add button within the Document Medication by History window. If the patient is unsure of the exact dose of the medication that they are on, you can still add the medication name to the home med list. You may already see medications that were previously populated within the home med list. Please review the list to make sure that it is current. Medications with the pill bottle icon next to them means that they have been populated by a medication prescribed through Castle. If the patient is no longer taking the medication listed, right-click and complete to remove it from the list. An example of this would be an antibiotic that the patient is no longer taking. Right-click also allows you to update the compliance on the medication. If that patient is not compliant with the home med, please add a comment to describe why. Now let's talk about social history. Default filters on our social history page shows all active documentation. So any documentation on the social history page will trigger consults to our dietitians, case managers, social work, and chaplains. It is important to keep the social history up to date and remove any old documentation. Now let's talk about some basic steps in documenting social history. Number 1, modify previous documentation by double-clicking on the assessment. Number 2, if you are unable to modify, remove that assessment and create a new one. Number 3, remove any other older documentation by doing a right-click and selecting Remove. If nothing changed and everything is the same, go ahead and click Mark as Reviewed. You will still be able to see these discontinued assessments by changing your drop-down filter to All. Now let's talk about medications on discharge. Remember to give education on any new medications. It is good to include the handout for that new medication as part of the discharge instructions. Finally, I just want to talk about eCoach. eCoach is a great tool to use for reference. You can access eCoach through the top of your toolbar in PowerChart or on the Connect page under My Toolbox. Choose the nursing icon to see all related job aids on nursing charting and processes.